Why do I have brown spots that are otherwise known as age spots, and what do I do about them? Melasma, what is it, and what do I do about that? First of all, any sort of abnormal increased pigment is caused by inflammation of the melanocytes. The melanocytes are pigment-producing cells that are in between the dermis and the epidermis that protect you from the sun. If you are internally inflamed, those melanocytes are inflamed and then they produce more pigment. They clump together like Custer's Last Stand, and that's what gives you age spots. So what do I do about it? First of all, you've got to treat internally. You want to avoid inflammation. Again, you are what you eat. Exercise. You have to have your hormones in a normal level. Then on the surface of the skin, you have to do the products that we've given you the solutions for, like vitamin C. Vitamin C, incredibly anti-inflammatory. It helps break up the clumping of the pigments. Melasma. Melasma is basically always known to be hormonally mediated, but really what it is again, inflammation of the melanocytes. The melanocytes migrate down into the dermis. And so in order to cure any sort of brown pigment, you've got to, number one, stop the inflammation, which is internal as well as external. Then what you have to do is exfoliate it off. You have to unclump those melanocytes. That's why you have to treat internally. That's why you have to use the maximal therapy externally. And skin of color. You have more melanocytes, and so the least little inflammation, you make more brown spots. Same therapy, you just have more brown pigment, you have more melanocytes, and therefore, but you still have to treat the same way.